Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to another episode of Stay Healthy. I am Mariam Salim, and today we're going to tackle the issue of colon cancer. Colon cancer is the third most occurring cancer in men and the second most occurring cancer in women. Helping me to unpack on today's topic is Dr. Umar Jean, consultant physician and fellowship gastroenterologist. Daktari, assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to the show.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Kindly start by telling us what is colon cancer.
A very interesting topic, alhamdulillah. It's good to discuss it with you guys. So, very pertinent also, especially in our setting. Colon cancer is basically cancer affecting the large part of the intestine itself. And colon cancer develops in people who are at risk. But before we get to that, I would like to explain to you parts of the digestive tract that are present and the multiple levels of it, and we can see how the colon actually affects all the other areas. So we start from the mouth, where the initial biting, the initial chewing, so digestion of the food takes place. We have the stomach lining, which actually takes care where there is the acid level itself, and the initial digestion also takes place there. The small intestines thereafter, preceded by the duodenum, and then there's the terminal ileum at the end. And of course the large intestines, which is in large called the colon, and then of course the rectum, which is the last part of the enlarged intestine, where there's a hold up of the stool, and of course the anus, where the exit takes place. I will actually show you. This is just a dummy of what the colon looks like, and this is where the colon starts from. This is called the terminal ileum. We call this the cecal area, whereby there is hold up of food and food material that comes from the intestine itself. Then of course the ascending part of the colon, we call this the transverse because it transverses the abdomen itself. And of course this is the descending part because it goes downwards, and voila, this is the sigmoid because it looks like an S, and the rectum itself, and this is where the anus is. So colon cancer is a cancer that can affect any part of this entirety as an organ itself. Okay. What are the roles of this? The colon mainly. The role of the colon is basically absorption of the water. The food that we take in is usually mixed with a lot of juices. So absorption of the water takes place at the level of the colon, and formation of the stool, which is actually the byproduct of all the food that we eat, and that is excreted. Okay. Two things that are important also to mention as part of the introduction is what is constipation and what is diarrhea. Constipation is whereby you have hard stools or inability to pass adequate stools at that point in time. Okay. Now diarrhea is basically defined as watery stools which are more than 3 times in a day. Okay. And many people actually have alternating constipation and diarrhea when it comes to development of colon cancer. So that is what colon cancer is.
So what are the signs and symptoms that one is suffering from colon cancer?
Signs and symptoms.
Yeah.
So you will actually realize that until the colon cancer is extensive itself, majority of this colon cancer remain asymptomatic for a long period of time. Okay, unless of course this cancer is large enough to cause blockage of what we call the lumen. Okay, the lumen is the inside of this digestive tract. Okay, so if you have issues if you have growths, for example, basically that is what is defined by the cancer itself, affecting the propagation of the food material that is going through there. Until then, the colon cancers actually remain asymptomatic. So we can say up to 40 to 60% of the people who have got early stages of cancer are actually asymptomatic. okay? But when these things grow big, okay, that is when they start causing the problems. Now problems such as diarrhea, problems such as constipation.
Won't that be too late by the time you get the diarrhea? Maybe it will be on the advanced stage.
Absolutely, absolutely. So these colons usually, or rather the colon cancers start off as small growths. We call them the polyps. Okay, so polyps are two small things that actually develop within majority of us, and almost all of us could be having polyps. Now that is when we start talking about the risk factors, but we will come to that very soon. Okay, these polyps usually develop into precursor molecules. We call them the adenomas. Okay, and those adenomas are the ones that proceed towards development of cancer. But you need to have the risk factors present for you to develop from a polyp to an adenoma to a cancer itself. Okay, so the main symptoms that actually people present with in colon cancer, one is pain. Okay, now pain can be either generalized because of the nerve supply itself, or it could be focal, whereby if the colon is affecting the right side of the intestine, we call it the cecum itself, then of course the pain will be originating from there. Now you'll also notice that over there is where the appendix is, on the right side. Okay, and people actually present with pain very similar to what we call appendicitis. Okay, and they are taken in and voila, and people actually try to look for that kind of thing. And when you do other forms of imaging or other ultrasounds or CT scans is when you realize that you have other problematic growths that are present over there. The other thing, of course, that you need to mention about is altered bowel habits. Now what do we mean by that? It means that if you are passing stool maybe once in a day or once in 2 days, for example, and you start changing that kind of frequency, okay, you start producing more of that or less of that, then you know that there is a high index of suspicion. That's one. Number two, of course, there could be the element of the hard stools, because you see the colon is responsible for absorption of water. Now if there is a holdup of that stool in the colon for a long period of time, all that water is sucked up. Okay.
But Daktari, before you continue, for example, maybe your stool changes. Maybe you used to go twice per day, or maybe once in 2 days, but then it changed because you change your diet, or maybe you're working out. Could that also affect?
No, that's a very important point that you've made. You have to have the risk factors involved. Okay, a high index of suspicion. And I think we are going to come to that as part of the discussion itself. But before we get to that, important symptoms that might be present is that not only there is altered bowel habits, there is combination of pain, altered bowel habits, then of course blood in stools. Okay, whenever you are passing blood in stools, that's usually an ominous sign. Okay, and blood can be very benign, by the way. Blood can be just a hemorrhoids having ruptured, either you're constipated, etc. Okay, or ulcers, for example, if the blood is trickled down from the stomach lining, you can have ulcers within the colon itself, and those are really benign things. Okay, but if you start passing blood in the stool, then you know for sure that's a red flag at that point in time. Then the other thing is loss of appetite and abdominal fullness. So by the time you're taking in food, okay, you take that amount, maybe 3-4 years ago you used to finish a plate, okay, but this time around, accompanying the abdominal pain, the passing of blood in stool, you start seeing that the stool, or rather the diet has changed. You're eating less and less, you feel bloated, you feel gaseous, etc. And you have other risk factors again, alright, then of course you start having a high index of suspicion for this. And of course, it's worth mentioning that people with early stage cancers might present in all this fashion, but people with advanced malignancies or advanced colonic cancers tend to present a lot more dramatically. And we do get patients who are like that, whereby they present with significant weight loss, for example. You will find a person who is 70 kgs a few years back, the guy has gone down to about 35-40 kilograms. Okay.
That is due to the fact that he can't eat a lot because he feels bloated.
Absolutely itself, yes. And of course, our system, our digestive tract is like a piping system. So if one part is affected, the other part will start complaining. So people with colon cancers or related malignancies might actually present with vomiting. So that's also a sign that there is complete blockage of the tract itself. Then if these colon cancers are invading the blood vessels that are present over there, of course bleeding will happen. Okay. And when you look at the colon itself, it can affect at any point of the colon, the cecum, ascending, the wax, everything. Okay. And of course the signs that are present that you need to elicit in these patients, of course there's weight loss that will be denoting that this patient has had this malignancy for most likely a longer time than actually present. Then there's the abdominal swelling, all right, that means that there's a lot of holdup of contents itself. And when you are examining the patients, there's areas that you might find that there is areas of tenderness, because cancer itself is a very painful condition. It invades the nerves, and once you get the nerves invaded, when you touch that area that is affected, definitely the patient is going to wince in pain. Okay. Now, advanced cases, again, whenever you are doing the examination, etc., there are things like yellowness of the eyes. Now, why does that occur? So, colon cancer favors, or rather loves, the liver. Okay. The blood supply from the colon is directed into the liver. So you will find patients who are actually coming in as a first sign being jaundiced. Jaundice means yellowing of the eyes. Okay. That means that that lesion that is present inside the colon tayari imepanda juu into the liver itself. Okay. Then dehydration is another factor that you need to consider, and of course because of malabsorption of contents, the diarrheas, the vomiting, etc., you might actually find these patients have a lot more like vitamin deficiencies, people who are falling sick more often because the immunity has gone very low. Yeah.
Daktari, hold on to that thought. Let's take our first break. We'll be back shortly. Stay tuned. Assalamu alaikum once again. Welcome back to our second part of the show. This is Stay Healthy. Joining me is Dr. Omar Jean. Daktari, before and for the break, you're telling us more about the signs and symptoms of colon cancer. Now, let's start by tackling what is the difference between colon cancer, rectal cancer, and colorectal cancer.
Okay, so that is usually a definition we make when you look at the parts of the colon itself. Okay, I will show you this image again. This is called the rectum. This is where the holdup of stool is before it is passed. When the stool is there, you feel the edge to pass. Unasikia kwenda choo. Okay? But when the stool is all over this place, you might actually not feel anything. Okay? This is the rectum. Cancers can be localized to that specific area only. Okay? Colon cancer is basically a general term for all of it, because the rectum also involves the colon, okay, in general terms. But when you are looking at the science now, okay, is when you start defining them at that level. Specific location, because it actually has a huge impact on what kind of therapy is going to be given to these patients. If you have a patient with a rectal cancer, for example, okay, and the rectal cancer is bordering the outlet, then of course you know that there's little that you can do. You might have to bring the stool out from a slightly higher point. Okay, we call that a colostomy. Okay, now if you have a patient with a localized cancer within the colon itself, then there is a definite role for surgery. So you can get rid of that part and achieve a complete cure for such patients. Okay, so depending on how fast you catch it, okay, that is when you can decide on how to go about it.
And which part of the colon which is affected by the cancer?
I mean, entirely majority of the cancers will affect the entire colon itself. Okay, about 30 to 40% will be affecting the rectum. Okay, but whenever you are making that kind of decision, it's mainly on the way you're going to advise on therapy or treatment plan for these patients. Okay, hope I've answered your question.
Yeah, you have. Thank you so much, Doctor.
Yes.
Is it true that only older men get this kind of type of cancer?
Because of the change in our diets, etc., so we are actually seeing quite a number of people who are younger. We have been doing procedures for patients and ages as young as 25, 27, 29, okay, tend to develop these lesions, and you actually unfortunately find features suggestive of colon cancer in that kind of age group. The mean age group for developing such cancers, okay, according to the American registry, according to our local data that is present, which is very little by the way, ages between 45 and going upwards is when you actually make the most diagnosis. Okay, now before it used to be around 50, 60 thereabouts.
No, it's coming down because of the
lifestyle changes that are actually present. Yes. Okay. Now, if I may talk about the risk factors that might be present, because it is directly related to that. Yeah. Okay. We will divide that into something called modifiable, those things that you can change, and non-modifiable risk factors. Okay, we'll start with the non-modifiable risk factors, whereby if the cancer gene, the gene itself for the cancer, it runs in the family, okay, we call it a genetic cancer. Okay,
so it means it can be inherited.
Absolutely.
Okay,
absolutely.
so you can pass it from one generation to another.
Absolutely.
Okay.
And that is very important, because if a parent is unwell and we know that he has had colon cancer, okay, this parent's offsprings need to be screened for cancer itself. Okay, and the recommended is actually 10 to 15 years before the onset of the cancer in the parent. Okay, so that's genetic aspects. Then our population is an African race. Now, how do we define that? It's because, I mean, when you do the studies in the West, for example, okay, they usually divide people into whites and non-whites, and they have noted that there is a higher chances of the African American population developing this kind of lesions. Okay, so African by the term itself is generalized to people originating or the roots from Africa itself. They are at a higher chance of developing such changes into the colon, and that can easily, so that makes us definitely at risk. Me being in Africa itself, because my genes or my epigenetics are in Africa, I'm considered as an African, definitely. Okay, and that basically puts me at a higher risk of developing colon cancer compared to the white man, okay, the American, the European, okay, the Scandinavian, who is out there. Then of course there are other risk factors, like we call them inflammatory bowel diseases, which can run in families. They are genetically predisposed, and those ones can predispose you to developing cancers. So those are non-modifiable. You cannot change your gene. You cannot change your family. You cannot change being African or not being African. Okay, those are things. Now, modifiable, whereby you can change them, is of course alcohol excess. Alcohol is something that affects many other organs. One of them is the colon itself. Okay. Number two, very important, smoking.
So just alcohol maybe, or other drugs?
There are other drugs, I mean, there is no direct correlation that has been studied as such. Okay, there could be, yeah, but alcohol by itself has been noted. People who take heavily are actually more at risk of developing colon cancer, and that is from the studies that have been done so far. Okay, excessive smoking, or smoking rather itself, it has got about 90 toxic molecules that are present, and one or two of them actually alter the genes at that level. Our diets, which are changing, okay, the diet that we used to eat, which was a high fiber diet, compared to the low fiber, the synthetic foods that you are having from the supermarkets, okay, the processed foods, the preserved molecules that are present, all right, all those can alter the molecules within the colonic mucosa that is present. And another thing of interest is that people who are diabetic are more at risk from all that, okay, especially type 2 diabetes, all right, so overweight patients, etc., okay, things like that will need to be a bit more cautious, or screening has to be done more regularly here, all right. And of course physical inactivity, like sedentary lifestyle. Now all those are correlated, okay, they are mainly lifestyle modification changes, that if you change your lifestyle,
so in short, Daktari, it's like you're telling us we need to be working out and eating healthy in order to prevent yourself from getting this kind of disease.
Absolutely, absolutely. In fact, not even colon cancer only, but all the other cancer.
Okay, thank you so much, Daktari. So can this disease be prevented?
Yes, absolutely. Now prevention is modifiable, non-modifiable, okay, modifiable risk factors of course, but prevention, it comes at a level whereby you're going to prevent the development of the severity that is present, okay. So first things first, early screening is what we recommend. And early screening are people who are genetically predisposed. If the parent is unwell because of colon cancer, the sons, the daughters should be screened for the same, okay. We mentioned that already before. Number 2, we do something that is called a screening technique. We call it a colonoscopy, all right. We're going to come to that discussion very soon. But when you do a colonoscopy, you actually remove the lesions that are suspicious. And here we already mentioned about polyps, okay. We cut them off, all right. Or we can, if the polyps have grown into things like adenomas, we also can take care of that using that kind of method, okay. Now if the cancer has not advanced, then there's a very high likelihood of complete cure, absolutely. And we have got a 90% cure rate, all right, which is a very high number in patients who are stage 1s, okay. The other thing is index of suspicion. If a patient presents to you with altered bowel habits, pain, and he has blood in stool, the guy is already 45, 50 years old, I mean, reason definitely has it that you need to investigate for things that are affecting our population, okay. So send him to somebody who can actually interrogate those symptoms better, and if he has to undergo some form of screening, and that is the best way forward. That's what I would advise.
Okay. So Daktari, once you are diagnosed that you're suffering from colon cancer, what are the treatment options that you have? So
mainly 2, okay, and I'll divide into either early stage cancer or late stage cancer. Now early stage cancer will be complete cure, can be achieved using surgical methods, okay. Now surgical methods don't go only, you have to use other medications. We call them chemotherapy for these cases, okay. Now chemotherapy are toxic molecules, they have to be given inside the hospitals. They are very, very expensive, okay. So I think NHIF etc. is trying its best for our local population to take care of it, but I mean that is something that prevention is definitely better than cure in such kind of case. Now advanced cases, okay, we call them the stage 3s and the stage 4s, okay. They can either go palliative therapy or supportive therapy. Palliative can be surgical or non-surgical, whereby you offer pain relief, you offer diversion of that stool content. So if you have a blockage somewhere and you cannot go ahead and do radical surgeries, okay, or major surgeries, you just direct the contents out so that that person can actually continue eating and can continue passing. It's the worst feeling ever not being able to pass stool, by the way, okay. And people come in quite a number of times really complaining, hawawezi kula, wanatapika kila wakati, ni uchungu sana kwa matumbo yao, okay. So all those things are actually there,
okay.
So
you have mentioned about colonoscopy. So tell us more about it, and also colostomy and colonography. I believe those are the words.
Okay. So I'll start with a colostomy, okay. Colostomy is basically a surgery done to divert the contents of the colon. Now for example, if I can show you over here, if you have a cancer sitting somewhere at that level, okay, let's say this is the example, all right, and if it is unresectable, all right, whereby you're not going to achieve a complete cure for these patients, you basically divert the stool contents and bring out that pouch into the surface. We call that a colostomy. Okay, so it's an opening on the surface of the abdomen, and it empties its contents directly into the into a bag. We call it a colostomy bag.
Also, you see those patients who have it like a bag on the side.
Absolutely. Okay, and that's a very poor quality of life, by the way. Many a times, I mean, people don't
Because you
like
can get
walking
infection,
around.
you can't walk around with
You
it
can't
freely.
really,
Yeah.
yes. There's a lot of stigma associated with it. Okay, now colonoscopy, on the other hand, is a gold standard screening procedure. Gold standard means that it's the best screening procedure, where you're going to insert a long pipe, which is about 1.6 to 2 meters long, okay, into the bottom part. We call it the anus. Okay, now when you enter with that pipe itself, we call it a colonoscope. All right, has a camera at the end and a lighting source. So as you're going into the the colon, you're actually examining the area,
the inside part.
Yes, and you have a TV at this over there, and when you're going to go in, you're going to actually see. So you're going to see the precursor lesions. Okay, we call them the polyps. You can see ulcers if they are the ones that are bleeding. As you're even entering, you have things like hemorrhoids that you can identify very clearly. And the colonoscopy ideally should be all the way to the extent of the colon to the cecum. Okay, the right side of the colon has to be achieved. All right, for a complete colonoscopy, because if you do half, all right, you reach over here and make a decision, that becomes unethical, number one, and you have not really diagnosed the problem itself. Okay, so that's something very, very important to note. The cecum has to be looked at, examined, because sometimes tumors can be located all the way
inside the cecum.
Yes, absolutely. Okay, and it is very bad. Mtu anakuja for a colonoscopy, unafanya hiyo colonoscopy, haujafikia hiyo cecum, and you make a diagnosis. Okay? Yeah.
So, Daktari, what does it mean when that your cancer has metastasized? Okay.
Metastasized just means spread.
It has spread.
Yeah.
Okay, like most part of it or to the other part of the body.
Yeah. So you see, colon is supplied by lots of blood vessels, and those blood vessels can carry the cancer cells away from the colon itself. So unaweza kuwa na chanzo, okay, the start of the cancer within the colon itself, but then that blood supply actually directs it elsewhere. Now the favorable sites for the colon itself, okay, to metastasize to, first, the liver. And I've actually shown you.
Yeah, you told us that the liver, that's where it
actually loves,
get attached.
yes, because the blood supply of the colon is directed
to the liver.
Into the liver itself. Okay, so the liver is almost always affected in patients with colon cancer, especially the advanced stages. Okay, the other things are like the lungs. You can have multiple issues inside the lungs. That's quite distant.
Will that also affect your breathing
No,
pattern?
definitely,
Okay.
definitely it will affect the breathing. Okay, then of course bones can be affected. So you can have, like, we call them the pathological fractures and related. Okay, you can have bone pains because of cancer. Is very painful, by the way. Okay, and cancer people actually suffer quite a bit. Majority of them is very silently. Okay,
Okay. Now let's take our second break. We'll be back shortly. Stay tuned. Assalamu alaikum once again. Welcome back to our third and final part of the show. Please join the conversation through our social media platform as we continue with the discussion. Daktari, welcome back again. So once you're diagnosed that you're suffering from colon cancer, what does it mean? Okay, and how does it affect one's quality of life?
I mean, so majority of the people we catch are late stage. Okay. So it impacts heavily on the quality of life. Okay, feeding is a problem, weight loss is an issue, the pain that is related is an issue. Okay, so all those things actually affect the quality of life. Now, one thing that is important is that we need to look at the quality of life from all aspects present. Okay, there's a social aspect, there's economical aspect. Okay, there is the fact that these patients are requiring frequent admissions to the hospital. There's that aspect of the finance. We call it pharmacoeconomics itself. Okay, socially, of course, these patients are going to avoid things like large gatherings. For example, if a patient has a colostomy, okay, even going to the mosque itself for a man becomes like an issue.
Also stigma.
There's definitely stigma that is present. Okay, there's that aspect itself. People who are suffering from advanced colon cancers tend to have pain that is related either to the intestines themselves, or if that colon cancer has spread elsewhere to the body, then those organs can be affected. The element of metastasis, for example. Okay, the higher the metastasis rate, the worse the prognosis. Okay, and the worse the outcome. So people who actually have stage 4 disease, only 15% tend to survive the next 2 to 3 years. Okay, so that's like an omen to the end. So that by itself, that thought itself affects these people, the quality of life. People tend to get a lot of depression, anxiety. Okay, they stay aloof from people. All right, because they know that they are going to be judged. Number one, okay, not only judged, but they're feeling helpless. They're feeling hopeless. They would like to do things. They would like to start up stuff. Okay, they are not able to do that because of the disease limitation. So quality of life is a huge problem, and it's actually poor. Now, on the other hand, if you are screening patients and you catch these patients early, trust me, these are the happiest people walking in this world. Okay, because they know they have survived from something that would have killed them. And everybody loves life. Okay, and you can see that in the COVID era. I mean, once you start talking about COVID, we should actually in such a discussion. Okay, we start talking about COVID, kila mtu anaanza kuogopa. Okay, hata mtu, people will not even tell you that he has been suffering from COVID because of that kind of stigma. You get, because everybody loves life. It's like a condemnation to the end. Okay, so quality of life is part and parcel of colon cancer, and it depends on how screening has taken place, how the diagnosis has been made, and people, if they undergo the reparative or therapeutic or complete cure surgeries, if I can call it that way, with additional medications, etc., these people live very good qualities of life. Okay.
You mentioned earlier that colon cancer affects mostly people from 45 years and above, like earlier, which was like 50 years. So what about children?
Very rare. Okay, I mean the pediatric populations, colon cancer, very rare. Okay, the youngest people that we have seen in our short time of practice so far is about 27 years of age. 27. Children itself, less likely, unless of course there are other genetic conditions that can predispose them, okay, to developing lesions all over the colon. And there are actually people, I mean, people can develop 1 polyp, 2 polyps, etc. Okay, there are people with thousands of polyps within the colon, by the way. Okay, we call that condition familial adenomatous polyposis. Okay, as the name suggests, it's familial. It is characterized by presence of adenoma, okay, adenomatous, and polyposis just means that multiple polyps all over. Now those polyps, when they can change their morphology, nobody knows. And if you diagnose somebody like that, for example, at a younger age group, they typically present with discomfort, pain, diarrhea, etc. Okay, in children age group, and you do that colonoscopy and you make the diagnosis of familial polyposis syndrome. Okay, you immediately refer them to the right people, and usually they undergo therapeutic surgeries whereby that part of the colon is taken care of, so that the colon is not there, the risk is also
not there,
extinguished. Are you getting?
Yeah. So can it be cured once it is diagnosed?
Yes, colon cancer, you can achieve a cure it. You can achieve a cure it and follow up is very important, because recurrence is another issue that you need to take care of. You need to diagnose these patients. There are modalities that are present right now, okay, and people used to go out for things like PET scans, okay, whereby you look for things like metastasis or distant spread, but you can actually do them here in Kenya these days, in Nairobi, okay, and of course it is at a higher cost, all right, but it is available service. So you don't need to start traveling far and wide, like medical tourism, etc.
Yeah.
Okay, it's available.
It's also very expensive.
Definitely, definitely. Okay, and of course, at this point in time, the COVID era, you are limited.
Yes.
You are limited to travel also. Okay, so cure rate is very, very possible if you have a stage 1 cancer. Okay, and that stage 1 is basically a lesion that is inside the colon itself, which is limited to the inside of the lumen itself, all right, and you get rid of it, all right, or you go for the surgery and you remove that part of a colon. More than 90% actually do extremely well. Okay, we call that the cure rate of 90. But now if you have a patient with a colon cancer, tayari the liver is affected, and when you look at the bones, there are already multiple deposits that are present.
So it has spread.
You metastasize, very good. That's a name given to it, metastasis. Okay.
Yeah, okay.
So that one now you will need to think about the best option to give to the patient. Okay, but they tend to not do so well.
Just to give them maybe palliative care for the time being.
Absolutely, and palliative care is a difficult thing, even for the providers, because it's very, very painful. Yeah.
So, Daktari, if you are diagnosed and you have gone through the treatment and you are cured, so how often should you go for checkup to ensure maybe it doesn't reoccur?
Very good, very, very important question. Now, what we do is that we are using guidelines that are not available in Kenya itself. Okay, so we use external guidelines that are present. Guidelines in Kenya still have to be manufactured. Okay, so from the research that has been done, okay, the first part of follow-up is going to be 6 months after that initial diagnosis. Okay, so for example, if you have a patient we diagnose with colon cancer and it's a local disease that is present in January, by June or July, which is around 6 months later, after he has undergone the surgery bit, okay, and the guy is basically declared cancer free, 6 months later you need to go in and see, all right, and that one is by way of a colonoscopy. You can do what we call a surveillance colonoscopy. You do surveillance. You look around for anything that is suspicious, and that area where the surgery is undertaken, that area you need to take some samples over there so that you check, is there anything that is starting to grow. If you find anything suspicious over there, please make sure you refer the patient to the appropriate people who can actually take care of it. Okay, now the other element of it is that if you have like a cure, if you are looking at a cure for patients with stage 2, for example, okay, stage 2 are also amenable, okay, to things like surgery or chemotherapy, all right, and those ones actually benefit from a more closer follow-up for these patients. Okay, so you need to make sure that the disease has not stuck into the small blood vessels, so you need to have an index of suspicion, you need to have a rapport with the patient, okay, so that the patient can come back to you whenever he starts developing the symptoms. There are other tests that you can do to check whether there is no development of other cancers affecting the colon. Okay, yeah, and those are usually the tests we do through the feces. Okay, we call them the stool tests. Okay, yeah.
So any advice you have to our viewers?
Prevention is better than cure. That's very, very important. Okay, prevention is better than cure. Early screening for people at risk, that is also very important. Okay, screening methods 3: history examination, colonoscopy, and the stool tests. Very important. Okay, and very important again, let's try to modify the risk factors, okay, towards the favorable ones. So let's do exercises, let's eat healthy, Let's avoid things that will lead us to developing malignancies such as that, excess of alcohol, smoking, etc. All right, these are things that damage lifelines, and they can be easily prevented. Okay. I think that's basically my advice.
Daktari, thank you so much. I really appreciate you taking time from your busy schedule to join us. Well, that marks the end of our show today. Join us next week. On behalf of my production team, Maasalam.